Good afternoon. Honorable Chief Minister Chandrababu Naidu ji, Excellencies and distinguished members on the dais, and esteemed delegates. I'm really delighted to be here at this historic moment. On behalf of the World Bank, I would like to congratulate the government of Andhra Pradesh on the many achievements that we just heard. And the whole idea of having a festival to celebrate the good practices and also recommitting yourselves to the healthcare of the people of Andhra Pradesh. Andhra Pradesh has been a true trailblazer in the health sector reform in the country and has harnessed innovation to improve access to affordable healthcare, including the use of technologies, especially IT, innovative mechanisms of service delivery, and financial mechanisms for healthcare. Andhra Pradesh is one of the most prosperous Indian states with strong and visionary leadership and committed and zealous officers who are striving to ensure that healthcare should be within the reach of every person of Andhra Pradesh. It is one of the first states for marching towards universal health coverage and providing quality healthcare to the population here. We have heard the many firsts that Andhra Pradesh is responsible for. In terms of the significant progress that Andhra Pradesh has made, whether be it on infant mortality, maternal mortality, looking at replacement fertility. It is also one of the, there was a recent ranking of the overall performance of the different states, and Andhra Pradesh ranked, in terms of the overall composite health index, it ranked 8th amongst the larger states. What was really noteworthy there was in terms of the overall performance, Andhra Pradesh is a front runner, whether you look at the proportion of low birth weight newborns, the proportion of institutional births, full immunization, in terms of the coverage, in terms of full immunization coverage, the quality of the data that is generated from the health management information system. And that only comes with the use of data. So it's not only the generation, but the use of data. Looking at how to address some of the vacancies in the health sector, and that's something which is an issue across India, but in terms of really looking at that there has been a lot of progress that has been made, looking at, in terms of having complete birth registration, looking at integrated disease surveillance programs, etc. Given the strong strives to make, given the strong drive to make further strides in advancing the health system, the government of Andhra Pradesh also prepared a project proposal that was just mentioned by Dr. Jitendra Sharma for World Bank support. And on behalf of the bank, we are very, very pleased to share that the Department of Economic Affairs has approved Government of Andhra Pradesh proposal for World Bank support for a very innovative project on Andhra Pradesh Health System Strengthening Project for $327 million that, among other things, will focus on transforming the primary healthcare system. And we just heard the vision in terms of having sub-centers and how that's going to transform the primary healthcare center. It also looks at the focus on enhancing the quality of care. I think that's, again, something which the government of Andhra Pradesh has been very proactive in terms of recognizing that that's one of the areas where there is, further need that's there, and really having quality of care and patient safety standards in secondary care hospitals, and also improving the skills of service providers, looking at how in terms of the whole non-communicable diseases and how, in terms of diversifying the skill sets that the health functionaries have. And last but not the least, the focus on the health system strengthening by implementing the third generation information communication technology to establish electronic health records using artificial data intelligence technology for better planning of response to disease outbreaks, etc. All of that has been envisaged in this project. We are really very, very proud and privileged to be partnering and actually sort of renewing our old partnership that we've had with Andhra Pradesh with the health system. And this is something which, in terms of our own strategy, what we look at is in terms of quality is something which is really a key issue that is emerging. and the project will focus on looking at enhancement of quality. What we also see that this project will be able to do, it has the promise to deepen the health system reform agenda and has the potential to actually provide for best practices and sharing of those best practices with other states in India. And I think that's something which we see that it will be able to create, curate, and disseminate knowledge and know-how and really contribute not only to better health of people of Andhra Pradesh, but also contribute to better health of people of India. Thank you very much.